Which administration method for parenteral iron helps avoid leakage into subcutaneous tissue? A. Z-track method. B. IM injection into the deltoid. C. Subcutaneous injection. D. Intradermal injection. And the correct answer is A. Z-track method. Z-track method is a type of IM injection technique used to prevent leakage of the medication into the subcutaneous tissue. Which test should the nurse check in her assessment of a patient receiving heparin? A. Complete blood count. B. PTT. C. Arterial blood gas levels. D. Hemoglobin level. And the correct answer is B. PTT. PTT stands for partial thromboplastin time. PTT test is the most commonly used test to monitor heparin therapy. PTT is evaluated every 6 hours during the first day of heparin therapy and 6 hours after any dosage change. The nurses are participating in a health fair at the local mall and are giving influenza vaccine to senior citizens. What level of prevention are the nurses practicing? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Quaternary prevention. And the correct answer is A. Primary prevention. Primary prevention includes intervening before health effects occur through measures such as vaccinations, altering risky behaviors such as poor eating habits, tobacco use, etc., and banning substances known to be associated. Which of the following are the 4 basic techniques of physical examination? A. Interview, inspection, percussion, resonance. B. Inspection, palpation, percussion, auscultation. C. Interview, subjective data, objective data, closure. D. Inspection, palpation, percussion, Glasgow scale. And the correct answer is B. Inspection, palpation, percussion, auscultation. Inspection, looking at the body. Palpation, feeling the body with fingers or hands. Percussion, producing sounds usually by tapping on specific areas of the body. Auscultation, listening to sounds. Which of the following terms denotes patient's inability to void even though the kidneys are producing urine that enters the bladder? A. Urgency. B. Retention. C. Oliguria. D. Dysuria. And the correct answer is B. Retention. Urinary retention is a condition where your bladder doesn't empty all the way or at all when you urinate. Who has decreased mortality by improving sanitation in the battlefields, resulting in a decrease of illness and infection? A. Florence Nightingale. B. Clara Barton. C. Dorothea Dix. D. Lillian Wald. And the correct answer is A. Florence Nightingale. During the Crimean War, more soldiers were dying from infectious diseases like typhoid and cholera than from injuries incurred in battle. Without wasting any time, Nightingale quickly set to work. She procured hundreds of scrub brushes and asked the least infirm patients to scrub the insides of the hospital from floor to ceiling. Nightingale herself spent every waking minute caring for the soldiers. In the evenings, she moved through the dark hallways carrying a lamp while making her rounds, ministering to patient after patient. The soldiers, who were both moved and comforted by her endless supply of compassion, took to calling her the Lady with the Lamp. Others simply called her the Angel of Crimea. Her work reduced the hospital's death rate by two-thirds. Transsphenoidal approach is used in the excision of which type of tumors? A. Glial tumor, B. Pituitary tumor, C. Oligodendroglioma, D. Acoustic neuroma. And the correct answer is B. Pituitary tumor. Transsphenoidal surgery is the most common procedure for removing a tumor of the pituitary gland. Rather than opening up the skull in a traditional craniotomy, the neurosurgeon reaches the tumor through the nasal passages and the sphenoid sinus. Cheyne-Stokes respiration describes A. Rapid breathing, B. Difficult breathing, C. Moist or stertorous breathing, D. Periods of apnea and hyperventilation. And the correct answer is D. Periods of apnea and hyperventilation. Cheyne-Stokes respiration is an abnormal pattern of breathing characterized by progressive deeper and sometimes faster breathing followed by a gradual decrease that results in a temporary stop in breathing called an apnea. Supination is A. Turn lower arm and hand so palm is down, B. Turn lower arm and hand so palm is up, C. Turn palm towards the inner aspect of forearm, D. Turn fingers position to midline. And the correct answer is B. Turn lower arm and hand so palm is up. Supination is the rotation of the hand or forearm so that the palmar surface is facing upward. Osler nodes and Janeway lesions are manifestations of A. Myocarditis, B. Endocarditis, C. Pericarditis, D. Aortic regurgitation. And the correct answer is B. Endocarditis. Osler's nodes result from the deposition of immune complexes. The resulting inflammatory response leads to swelling, redness, and pain that characterize these lesions. The nodes are commonly indicative of subacute bacterial endocarditis, whereas Janeway lesions are irregular, non-tender hemorrhagic macules located on the palms, soles, thenar and hypothenar eminences of the hands and plantar surfaces of the toes. They typically last for days to weeks. They are usually seen with the acute form of bacterial endocarditis. A CT scan of the head shows a collection of blood between the skull and dura mater. Which type of head injury does this finding suggest? A. Subdural hematoma, B. Subarachnoid hemorrhage, C. Epidural hematoma, D. Contusion. And the correct answer is C. Epidural hematoma. An epidural hematoma is a collection of blood that forms between your skull and the dura mater, the outermost protective membrane covering your brain. The cause is usually an artery that gets torn by a skull fracture. Symptoms include severe headache and loss of consciousness. Which one of the following represents the full form of AED? A. Autonomous external defibrillator, B. Automated extracorporeal defibrillator, C. Automated external desynchronizer, D. Automated external defibrillator. And the correct answer is D. Automated external defibrillator. AED stands for Automated External Defibrillator. Which one of the following cardiac rhythm is non-shockable? A. Ventricular fibrillation. B. Pulseless ventricular tachycardia. C. Supraventricular tachycardia. D. Pulseless electrical activity. And the correct answer is D. Pulseless electrical activity. Ventricular fibrillation, pulseless ventricular tachycardia, and supraventricular tachycardia are all shockable rhythms, whereas pulseless electrical activity is a non-shockable rhythm. Which of the following sign is positive in deep vein thrombosis? A. Homan's sign. B. Jacquemuir's sign. C. Kernig's sign. D. Hager's sign. And the correct answer is A. Homan's sign. Homan's sign is often used in the diagnosis of deep venous thrombosis of the leg. A positive Homan's sign, that is calf pain at dorsiflexion of the foot, is thought to be associated with the presence of thrombosis. Which one of the following vitamins is not fat soluble? A. Vitamin A. B. Vitamin D. C. Vitamin B. D. Vitamin K. And the correct answer is C. Vitamin B. Vitamin A, vitamin D, vitamin K are fat soluble, whereas vitamin B is not fat soluble. One example of isotonic solution is A. 0.9% sodium chloride, B. 0.45% sodium chloride, C. 3% sodium chloride, D. 5% sodium chloride. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.